every nose is a challenge in the sense that you have to meet the artistic challenges. And when you're performing a rhinoplasty, it's all about little millimeters, half a millimeter, quarter millimeter, millimeter here, millimeter there. So there are a lot of ambivalences during surgery. Should I take out another sliver? Should I file this down a little bit more? It's like a painter when he says, do I need one more bird here? Do I need a little bit more green in this tree? So I have to design the nose, and my two main points are, it has to look like it was never touched, it has never been touched, and create the necessary enhancements this nose needs for this face. What brings you to see me?
I would like a nose job because I think that I have a deviated septum, and I broke
How do you know that?
Because it's hard to breathe.
When I'm looking at you and I can see that it's a little crooked, but you know, you have a beautiful, beautiful tip definition. So now give me a little side view. So yeah, turn to your mouth. Okay, now I see what you're talking about. Now I want to examine the inside of the nose to see how deviated the septum is. So I'm going to look inside your nose. This does not hurt at all. Let me just take a peek to see how your septum is. Left side is fine. Right side, you have about 60% obstruction. There's two bends in there. Chin down just a little bit. So the one in the front, one in the back, and there's two different angulations, and both blocking your breathing on the right side. Now I'm going to do something. If I do this, do you breathe better?
Yeah.
Yeah, so that's a valve. We call it internal nose valve, nasal valve, which has also been encroaching on your airway. So I'm going to fix that by using what's called a spreader graft, and I'm going to explain that to you.
Okay.
Yeah. So instead of throwing away the broken pieces of cartilage, I will use that to open up the valve. This is this effect right here. A lot of people wear what's called breathe rights.
Right.
Yeah. Have you tried that ever?
No, because I don't really snore, so I never really thought to try one.
You should try that. It's a very good idea because it gives you the same benefit, you know, and that's what I'm going to do. So in surgery, that broken piece of cartilage, instead of throwing it away after straightening the septum, I will stitch it in here where it's narrow. That's the internal nasal valve area. And by opening the valve by using your own cartilage, and we call it spreader graft. It doesn't show, it's all in the inside, okay? And let's go back and talk a little bit more. I do everything from inside the nose, so there is no outside cut. It's called closed rhinoplasty. Put a beautiful face like yours, I think it's not right to put a cut right in the bottom of the nose. I have never done an open rhinoplasty. I don't like open because I don't want to run the risk of a scar. So I do everything from inside the nostril. I can fix your septum as well as, you know, take care of the bump from the inside. And it heals much faster with the closed rhinoplasty. There's a surgery center in the back, and you go home the same day. Most of my patients don't get bruising. I would say 50% don't get bruising. The other 50%, if they do get it, it's gone within the first 4 or 5 days. So my goal always is, so the day I take the bandage off, that she can go out for dinner or go to work or go to school. There's some discomfort because of the fact that first couple of days you are going to have a little sponge because the septum is crooked, and if I straighten it, then I need a sponge on each side of the septum for a couple of days, and after that there's no pain. Ask me some questions.
Well, every time I take a picture, the first thing I see is how wide my nose is. So are you gonna do something to make it a little skinnier too? Not too skinny, but...
Let me see. So yeah, the bones are a little wide. And it's probably due to the same trauma, the injury, you know, the bones are supposed to be like this, and something hits the bones and it just, they get wide and they get uneven. And that's what I see. And the right bone is a little bit wider than the left bone. But this is very pretty. I love the tip definition. It's really, really pretty nose and beautiful cheekbones, beautiful eyes. So you're going to have a stunning result, you know, absolutely stunning result. Give me a smile. See, pull it down just a little bit with the smile. Great. Look at that.
Looks good.
Beautiful, huh?
That's beautiful.
What do you think, huh?
I love it.
And you know what? Look at this carefully. I've left a little tiny, if you give me permission, I've left a little tiny high spot there.
Yeah.
I like that to keep it natural because, you know, you begin, beautiful beginning, huh? And if I lower it too much, it'll be not as complementary to your cheek. So
Yeah.
I want to preserve the integrity of the nose and keep the bridge strong because, you know, you have beautiful eyes and the cheekbones, and it dictates that we leave a little imperfection there, and that's going to keep it natural. So I would assess that the bump is approximately about 4 millimeters, and we will shave it down 3.5, and leave a little imperfection. I think that's a very, very classy thing to do, to keep it natural. Look at that. I think that looks amazing. Huh? Beautiful. Still her. The nostrils are beautiful, the angle is beautiful, the tip definition is beautiful. So all I'm doing is I'm just going to shave that down and leave a tiny little, where the bone meets with the cartilage, leave a little tiny imperfection there. In the front view, you see, like you said, bones are a little wide. They're photographing right there. And so we need to narrow them a little bit and bring them into this configuration. And so they will be a little bit narrower. Again, tip is gorgeous. I'm not going to touch that at all. You see this bone also is wide, so we need to just get into this and it'll look amazing. When you smile, you pull the tip of the nose down because this muscle here is very strong. So I'm going to pick at that muscle, weaken it a little bit so the nose does not come down. Elizabeth is going to start the IV, so don't anticipate any pain, okay? Just a tiny little bit. And then we'll ice it, and then little by little. And during the surgery, there's no, you don't hear anything, you don't, you know, you hear stories like, you know, am I going to wake up in the middle? No, you're not going to do that, okay? So just happy thoughts. Okay. Yeah? This is the before, and it shows that the projection of the nose is a little bit much for her. And this is what I had drawn and shaded for her to show her and get her approval and her mother's approval. I'm not making it perfectly straight. I'm allowing a little imperfection where bone meets with the cartilage. I'm going to leave a little high spot to keep it natural so the nose does not look like it's been scooped. The tip definition is very pretty. We're not going to touch that. We're just going to narrow and straighten these bones, and that's going to make it really softer version of the same nose. The whole idea with the noses is you don't want to change them, you just want to refine it, and if you target yourself to exactly what needs to be done, that's what can be accomplished. I call it finesse rhinoplasty. We ice the patient for an hour before the surgery, and this is called intraoperative, during the surgery icing. This is a sterile glove. It's got 4 ice cubes in there, and we put 2 ice cubes on each side of the nose to cool down the nose and the face. So there's minimal bruising, minimal bleeding. And this will sit there on the nose and the face for 80% of the surgery. The surgery will take approximately about 45 minutes to an hour. The only time I take this off when I'm working on the bridge. But when I'm working on the septum, this stays there because it does not interfere with my work. It's called intraoperative icing. I want to deliver a nose which is going to function better than ever before, and then I want them to like it, enjoy it, grow into it for the rest of their life. So the cartilage profile has been lowered, the bony profile has been lowered, and you can see how much projection there was, excess projection on the tip, and the lower half and the upper half. So I maintained a beautiful beginning, coming down, little high spot, and look at the profile. Beautiful, absolutely beautiful. We'll give you little ice chips, huh? It looks really beautiful. Nose, I'm very, very happy, and it fixes your breathing also. You know, nose looks really nice. You're welcome. You okay? Comfortable?
I just can't breathe.
Yeah, that's natural because you have a sponges there. Just till Sunday, okay? Just bear that with me till Sunday. Okay? We just gave you a little bit pain medicine through the IV, and you'll be comfortable very soon, okay?